actually like to build on what Anastasia just shared with us around partnerships. But before diving into that specific example for SMS for Health in the Gambia, let me also give you a quick background on how come that Vodafone is more and more looking into that area, and actually that the business for us in the mHealth area is also nicely expanding. As a mobile network operator, we are active in this mHealth space already since quite some time. And what we realized over the past years is that there was an increasing demand coming from the pharmaceutical sector, coming from the medtech sector, but also coming from developing markets. And it goes a little bit along the lines that Anastasia shared earlier with us, that we see emerging of different sectors. And in our case here, we see emerging between this, let's call it the 5 trillion healthcare sector and the 3 trillion telecom sector, because, I mean, for all of us, mobile technology or mobile phones are not actually perceived as technology anymore, but it's part of our daily life. And that finally this increased demand led then to the establishment of a business unit in 2009. Maybe one additional point I would like to raise in this introduction to you is that we are a commercial unit, and we also have as Vodafone a foundation which was established about some 10 years ago. The mission we have as an mHealth business unit is basically to improve healthcare outcomes and quality of life by giving patients and healthcare professionals increased flexibility and freedom. And this is something I hope that can be easily understood, and that's also in the DNA of a mobile network operator. When I look at the approach which we are taking as Vodafone in that area, there are maybe 2 or 3 points which might be worthwhile noting for you as the audience. The first point is we might have a different business model, and that's a business model beyond connectivity. What I mean by that is when we offer solutions in countries, take the example like SMS for Health in the Gambia, or similar examples. When you go into broad target groups, you need to offer solutions which are network agnostic. And that is something that's part of our portfolio of products which we are offering. And then at the same time, we are also trying to offer end-to-end managed services and to take out the complexity in the solutions for our customers. And I think these are 2 things which are increasingly important also in the mHealth space, to provide credible solutions that also resonate very well with the users in the end. Before I dive into the example, as you can see on this slide, we are offering different solution areas from remote care services over mobile flexible working, clinical research. The part that is most interesting in our conversation right now here is the mobile flexible working area for the emerging markets, and also in particular the access to medicine, because this is something which is a big need in the emerging markets where we can provide significant support. If I now dive into the example, which I would like to share with you, and I now need the support of my colleagues because I'm having some technical problems here. If you could switch to the slide number 6, which is called Access to Medicine, I would like to share the example around SMS for Health in the Gambia with you. This is actually a story we jointly developed with Pfizer, and Pfizer was actually the trigger point for starting this project in the Gambia. The project lasted initially, or the pilot lasted from summer 2010 until early 2011 during the pilot phase. And basically the trigger point for Pfizer was that there's such a big need for healthcare support in countries like the Gambia, and as a mobile network operator, we can make these things happen and bridge the lack of infrastructure there, that we started this partnership. Then we also included in this partnership the government. Actually, the government was driving a significant part of the initiative, and they defined the specifications for the need of the project there. And as Vodafone, we also partnered with a supplier that could help us to make these things happen. What is the contents of this SMS for Health project? Actually, it's a project that allows in the Gambia to monitor stock levels of drugs, expiration dates, and also top healthcare events in the country. And the Gambia was taken because the Gambia is actually it's a fairly small country with a population of close to 2 million people, and Pfizer was also interested to pilot a project there, which is actually pharmaceutical company or drug agnostic. So the products we are monitoring here are also not restricted to Pfizer products, but they also include additional products. And long story short, this project turned out to be a very, very nice success. And the way of how the project was developed, and now I ask my colleagues on the webinar to switch to slide number 7, was that we first had the pilot implementation, which was driven by us. We were kind of the project coordinator. But the government was a significant part there because they helped to define the needs, because they have the best understanding there on the situation in the country. After the pilot, the project was then handed over on the financing side to an NGO, to IHP, and that is a challenge when products like this are run into emerging markets to find a sustainable business model. We are right now working, and that's the third part of this collaboration. We are working on securing continued funding via the government in the Gambia. If you could now kindly turn over to slide number 8. What were the key takeaways for us, or the key learnings in order to make this project happen? I wanted to highlight 3 points here, and the first one is, if you do a project in a country with multiple stakeholders, you need to have the endorsement of the local government. You need to make sure that you're truly addressing the key needs in this country. And so in the first phase, you could almost say that the government was very much in the driver's seat, because they have by far the best understanding, of course, of the needs in their country. And then in a second step, another key learning for us here was to truly create a win-win for all stakeholders. And this is often easier said than done. I would just like to raise one point here. Stakeholders are, of course, not only the government, Pfizer, Vodafone, or our partner who helped us to make the training happen, IHP. Stakeholders are, of course, also all the nurses and healthcare professionals who are using the technology to key in information about drugs, around certain indications in their mobile phone, and send it to a central hub, to a central warehouse. And of course, we had to see and to identify a way of how to incentivize the healthcare professionals to participate in this process. And it was done because we transferred credits upon the correct typing in of required information in their mobile phones. They received credits on their accounts, which secured and still secures a continuous buy-in. Lastly, I would like, on slide number 9, now give you a little bit of an outlook. Where's this whole story heading? We would now like to expand this platform across more countries. Actually, this project initially started in another country, in Tanzania, but there we didn't have drug-agnostic approach where we included 20 different drugs. We first started in Tanzania with one product. Then we expanded the project into the Gambia, and we showed that the platform is also extremely beneficial for our country and for all stakeholders when you expand it to 20 drugs. But now we have established a kind of gold standard which we would like to roll out to more countries. And this is right now what we are working on. What is the key barrier to overcome? A key challenge is always to secure the initial funding over, we'd say, over a 3-year period. Because somebody needs to be willing to take this risk and say, yeah, there's something in it for us, and I'm willing to finance this for an initial period. And then over time, once you show the benefits, it's a little easier to find additional supporters to make this a sustainable product. Ultimately, we would like to broaden this platform also and to use it as a first start and then complement it with technologies, SMS-based technologies for drug authentication, or SMS-based technologies for education around drugs and healthcare. Or some of you might be familiar with our M-Pesa model, where you can use the mobile phone to facilitate payments. But we see this as an initial platform that has the potential to expand. Before closing, let me address also some learnings from our perspective around B2B relationships here. And I would like to focus on an element, because I heard that also some of you are coming, or several of you are coming from smaller, very entrepreneurial companies. And I would like to focus on B2B partnerships, in particular between big corporations like, for example, Vodafone, and smaller corporations. As Vodafone, we have several of these B2B partnerships happening. And these partnerships are mutually very beneficial, because the small companies are typically very fast, very innovative, come up with very interesting, very good solutions. And as a big corporation, you have, of course, the customer access, which can help to broaden the product, to bring it into a broader public. But we also have the experience, and we're actually very rigid on quality standards. And this can also help the smaller companies to make their solutions more stable and even more appealing to customers. I would not like to say I would like to share learnings, but more observations around these partnerships with you. What we realized in these partnerships, and we're having plenty of discussions like that with different partners, is that very often the smaller companies have a more of a technology focus. They say, well, we developed this, somewhere out there must be a customer. I exaggerate to some extent on purpose here. And as a big corporation, you're, of course, very much customer-driven, and you say, who's willing to pay for this solution? How can we find an angle there? And that is very often, it sounds trivial, but that's a key barrier that need to be overcome first. Yeah? Then the second one I already mentioned, that is the quality standards of big corporations. That can be a new experience for smaller companies, and it also links to the last point, which we experience very often as a challenge in these partnerships, and that is simply the different cultures. When a smaller company, which comes from an very entrepreneurial spirit, is working with a big corporation, you have often the challenge of just bridging these cultural differences, and the best way to bridge it is to interact over a short period of time very intensively and getting to know each other better and better, and then have a first project which is a big success for every partner, because only the success brings you more and more together. So that's the summary from my side. I would now like to hand back to you, Susan. Thank you.
Axel, thank you. That was